All right, in this video we're going to talk about elbow palpation. So we'll start with the humeral ulnar joint. So when we're palpating that humeral ulnar joint, there were a total of 4 different palpations that we did. So the first one was long axis distraction. We said that we could block this distal humerus by using a web contact, and then using a digital contact we could wrap our hands around the elbow itself, palpate the olecranon process. So what that looks like is a blocking of that distal humerus, wrapping around. You can kind of see my fingers over here around where that olecranon process is. And I'm going to block with my thumb as I distract with the radius and ulna, and then as I release, I can feel that olecranon process rebound. The next 2 are lateral to medial and medial to lateral glide. To set this palpation up, we need to fully extend the elbow and then unlock it. When we unlock it, it's just a very slight bend. So very slight bend, and then I can challenge with kind of my hand-heel contact. I'm not on the humerus, I'm on the radius and ulna here, and I'm applying a pressure lateral to medial and medial to lateral. Okay. The last humeral ulnar palpation that we did was a P to A palpation. We used a digital contact on the olecranon process, so I used 2 fingers and I palpated just at that olecranon process here. With my patient's arm in full extension, I applied just a slight overpressure with that digital contact. And I should be able to feel that olecranon process kind of spring back and forth as I apply that pressure. We then did radial ulnar joint. So for the radial ulnar joint, we can start with a P to A palpation. We find that radial head, we use a thumb contact on that radial head, and then apply just a little bit of overpressure. We should have a nice spring in that radial head as we palpate there. We then have our patient sit on the palm of their hand here, and we use a thumb contact as we palpate that radial head, and we traction over. So we traction that soft tissue over towards the radius, and then provide a force, an A to P force here while palpating with that thumb. So here is that contact on the radial head with my thumb, and then I'm going to traction over, and I'm going to have my patient to lean away from me, and I will just a light spring here on that arm to see if I can feel that radial head come anterior posterior. The last 2 then were pronation and supination of this radial ulnar joint here. And so what we did was we palpated that head of the radius, and then we did a pronation and supination as we went through that palpation.